This is the injury, just so everybody at home can see. Yeah, it's just so loose. There you go.
I've trained myself to now sleep on my side, so like halfway I'm sideways, but then I always end up on my stomach. So.
How long do you think you've been a stomach sleeper?
My whole life.
Okay. And as your chiropractor, you said you're seeing a chiropractor, have they mentioned that at all and what to do about that, or what's their
well, yeah, they. I know it's like frowned upon, right? Because it's like the worst thing for your posture, for your body. But no, it's something I've been kind of like going into myself and kind of like learning. And
it's okay. I'll give you all the answers.
Yeah.
Never been accused of not talking enough. So we go to our stomach to get away. It's an avoidance posture. We can, there's problems in our back, and so if we lay on our back, we feel them, and so we go to our side or our stomach to run away. It's because there's a problem in your back that you obviously already know about, which is why you're self-proclaimed self-adjuster, you told me. And so for how long do you think you've been self-adjusting?
As long as
20, 30 years.
Well, since elementary school,
okay.
Literally.
Like we were saying a little while ago, the desire to pop the spine comes from the joint. The joint gets inflamed or swollen, and then there's air bubbles in the joint also. That's what makes that sound. And then when you pop your own spine and releasing the air bubbles, it makes it feel less pressurized in the joint, gives you relief. The problem is you're mainly only going to loosen the ones that are already loose. By 50, sometimes you'll start seeing bone growth in the lower neck, and you don't see bone growth in the upper neck, wherein the upper neck isn't working properly and the lower neck is overworking, and then the nerves that you already told me are going to your shoulder start getting upset. And so taking stress off the lower neck, bringing the natural curve to your neck back, what that curve does is allows the weight to be evenly spread. And I know you said they told you it was reversed and now it's straight. We want to work on aiming you to as much curve back in that spine as possible. That's actually going to make the joints not inflamed, so you won't feel the desire. Ultimately, just adjusting people or massaging or electrocuting or lasering, it won't put the curve in your neck. And so your desire to self-adjust won't really change until we aim that spine back into that curved position. The adjustments are just made to make the spine limber and to balance it so we can actually mold that arch back in the spine.
I also have hypermobility because of, I guess, my self-adjusting for so long. So a lot of people don't think that I have a problem because I have the mobility.
Correct.
But I still have the pain.
This is why global range of motion is silly. In school, they have these things called inclinometers, and we measure range of motion. And what you're saying is, Ed, I got a lot of mobility in my lower neck, not enough mobility in my upper neck, but my total number looks good still, right?
Yeah.
So the total range of motion looks normal, yet it's not happening evenly. And that's a problem wherein, essentially, if you kept chewing on the right side of your mouth, the teeth on the one side will get worn out faster. I'm still chewing my food fine, but you're not chewing evenly.
Yeah,
and so it's important that we have the whole spine working as a team, when in fact usually the lower neck and lower back are the ones that are 99% of stress surgery happens in the lower back and lower neck. You said you have headaches, or you did have headaches a lot before?
For up until maybe 5 years ago or so, I used to, I would probably say about 15 years or so, I used to have migraines the majority every single day of the week.
Oh, wow.
And that's when I found out one day that I had a reversed curve. Yeah.
Yes, that's the huge. All right. Is there numbness right now? Is it numbness left hand or left side?
Sometimes. So because of this whole situation, it's caused like an impingement in here, and sometimes it can go if I raise my head overhead.
I'm gonna look at that posture. Left shoulder, left. Okay. You're essentially you're getting away from this right side. So the right side has an injury, and now what you're pinching the left lower, which goes to your left shoulder. Does that make sense? But it's really the right upper side that's the problem, and I'll show it to you in a minute.
Even though I feel everything on this side.
You're pinching that, but you're in a right avoidance. The head is tilted, so we can't. Let's see if I can explain this. So if we have an injury on the right side, my head goes. If I break my right leg, I'll get my weight on the left side, right? It's called antalgia. So antalgically, the joints, there's nerve pressure on the right. It's gone. And now what happens is I can't walk around with my head tilted. It makes me dizzy. So I'll drop my right shoulder to make my eyes level. We call it a righting reflex. Your eyes always have to be on the horizon. We try walking around with your head tilted very quickly. It's not fun. So your eyes will always seek that horizon. There's an injury on that right side. Left hip is high, about a ½ inch high on the left side. Straight forward, you got it. And then we're dealing a little bit head forward. This is where, again, the life and work of looking forward and head. The head weighs about 10 pounds. About every inch it goes forward, the muscles have to double their workload. So 10, 20, 40, somewhere between 20 and 40 is where your muscles are working more than what they're meant to handle. Does that make sense?
Yeah.
Because the posture is amplifying. Like if I hold a bowling ball close to me, it's not as difficult as if I hold it far away. My muscles are working harder. The same thing with your head. When the head goes forward, it puts more stress. It's actually harder to breathe. An easy test to do, just real quick with me, is push your head forward. Now take a deep breath in. Okay, now bring your head back. Try to take a deep breath in. It's a lot easier to breathe. How important is breathing?
Yeah.
Pretty important, right? And there's a couple other ones where you can just humor me. Push your head forward, and then try to bring your arms up from the side. You're better than me, but that's about it.
It's part of the hypermobility.
We can't even, you can't even put your arms up.
Yeah.
Isn't that crazy? Now bring your head back, and you can.
Yeah.
You can bring your arms
All
up.
the way up.
All right, just go ahead and just turn your head left for me. Any pain when you turn your head left?
A little bit of a pinch.
On the left.
Yeah.
And then turn your head right for me.
No.
Nothing to the right, pinching the left. Okay. And then go ahead and look up for me. Any pain when you look up?
No.
Okay. Last point before I work on you. Why we can't have the stomach also sleeping is that when you turn your neck past 45 degrees, the curve has to be straight or reversed. So essentially, if you're sleeping with your head turned all the way, you're sleeping it with no curve or reverse curve all night long, right? That makes sense. You're stretching the curve out of your neck when your head is turned all the way. So the goal with sleeping is to be somewhere in between 45 and 45, and it's just more difficult, and it's easy to just have the head turn all the way. Does that make sense?
Yeah.
When you're sleeping on your stomach. And so we want to make the spine clean, make it not painful to be on your back, and then that's how I fix stomach sleep. Sit up, and then let all the air out. Head back for me. Keep going, keep going, keep going. Beautiful. Take a deep breath in. 2 more. And exhale. Relax your chest. I got you. Nothing there. Okay. Deep breath in. Head back. Exhale. Okay. All right.
My shoulder's popping.
Your shoulders. Yeah, you have too much mobility down here, and I would say still limited in your upper back. We got to get that moving better. Maybe side facing me. There you go. Put your hands around your belly for me, and then take a deep breath in. Exhale. Keep twisting. Keep twisting. All right, other side for me. Exhale. Yeah, it's just so loose. Face up for me. Okay. I would argue that we should be I would spend like a few weeks or a month just on restoring the mobility of your chest before we do even that side posture again. I wanted to assess it today, but it's so imbalanced, and here it is. So feel this big bump right here?
Yeah.
There's a bump on the right side.
Yeah.
I got almost nothing on the left. That's why you're pinching it, but you're tilting your head left to get away from this guy. There's the problem. And then you're going to abuse the left lower neck, left shoulder. I'll even the bones for you. Right about there. The bones are level in your neck right now.
Right now.
But your head had to tilt 15, 20 degrees to the right. That makes sense? To
Yeah.
get the bones to be level, kind of like when your handlebars and your bicycle didn't line up together, okay? By 45, 50 is when most people, the cartilage called the disc wears out, especially if you keep hypermobilizing the lower neck.
Yeah.
You're going to wear out that cartilage. And the cartilage is the basis for pretty much why I have a job and why I work on people, because the discs don't repair, they can be rehydrated, but they don't heal, they don't replace. And so we have one set of discs, we have 2 sets of teeth, we have one set of nerves, and we have to make them last 90, 100 years or whatever, and so we don't want to age them prematurely or at an accelerated rate. Easy, there you go. There you go. You okay?
Mm-hmm.
There you go, very nice. There you go, relax, relax, yeah.
I had people really pull my head, it's almost like you're gonna turn it around so hard just to get a crack out.
That's
but you
not
barely
good.
moved me.
I know.
That's crazy.
It's almost like it's a must. No. Well, because I didn't want your lower neck to move, right?
Yeah.
We got to be really careful. it felt like your lower neck was like, pick me. I'm like, no, you quiet. You sit down.
Yeah.
And I just wanted your upper neck to move.
Sit for another class.
Yeah, no, I just wanted this guy. If you see chiropractors doing that, they're probably popping the lower neck more. I've seen bigger, but it's bigger injuries, but yeah, right there. That has to be, I'll show you the left side in a second. The left doesn't have this dent. Or, I guess it's more of a bump. The beauty of the upper neck is that it doesn't wear out. All of this is ultimately due to the upper neck not doing what it was intended to do. Why did that happen? Good question. It starts at 5 years old when we're put in school and we lose the curve in our neck by looking down for 8-10 hours a day. That's what starts it, and nobody says anything, and we don't connect the dots that our posture is creating the mechanical imbalance.
And so now, of course, I'm trying to be more cautious of my posture even at work. Like when I'm taking someone's orders, they're just looking down, I'm like...
Mm-hmm. But you're down and to the left. That's the first issue, is that when you're taking orders, your head's going down and you're going...
Yes.
You're saying, so we got to try to go, well, I don't know. You try to elevate it. I don't know.
I know.
As impossible as that might be, use your peripheral vision, use your eye. Try to keep your head as level as it could be. Don't be as far forward as you can be.
Yeah.
And you need me in your life. There's a significant mark here on the right side that I, told you there was going to be. I'll take a picture of it in a minute and I'll show you. But this is the injury, just so everybody at home can see. There's our injury.
My coworkers are like, what happened?
Right. Well, he found the source of why I want to get on my left side.
Maybe my guests are going to be like, this poor girl.
Right. Well, because she's trying to get away from her right side.
I got to under it though, right?
Yes. I'm going to get the shoulders in a second.
Oh, that's tender.
More monsters that you want to get away from.
They're right there.
Yep. The roots of our neck are here. So these roots get pulled up more when our head goes forward. And so just massaging these roots, ultimately, the pain here won't ultimately go away until we get the head back and the curve back in the neck. But it doesn't mean we can't go in here and try to alleviate some of the pain and soreness. But this is really a domino effect. This is a byproduct of the head.
Actually, not that long ago, went to a masseuse, and poor girl, she was nonstop just in this area here, and she's like, I don't know what it is. She goes, is that a muscle? What's going on? She goes, it will not die down, and she was trying so hard.
Let me
Elbows,
Let me
everything.
show you how scary this gets. You ready for this? So if your head's forward, right, and you have all this tension and pain in your neck, right, and then I go in here and just massage you, right? If I just massage you and I loosen and I lengthen all these muscles in the back of my neck, I had to go farther forward. Scary,
Yeah.
right?
Because it relaxes there, right?
Right, you just lengthen all the muscles.
That makes sense.
So now my head's even farther forward. Now I have even more tension. It's getting worse, Ed. Even though I went and got a massage, why am I not getting better? Because we have to end with this stretching. We have to end with taking you back so that we don't use all the table work just to loosen you up and then you end up just go sit in your chair. Right?
Yeah.
And we just mold. Scary place. Notice the huge difference here. I mean, they're kind of smooth as anything this side. There's no bump.
That's crazy.
This is abused. So the rib rises up and it forms the bottom part of the funnel. There's a funnel where the brachial plexus, the nerves that come off your lower neck, go down this channel to your shoulder. The bone represents the top part of it. The rib is on the bottom part. And then everything's funneling, 2 walls, right? And then everything's funneling in between the vertebrae above, the rib below, and the channel itself is the muscles. The muscles occupy the channel, and so if the muscles are all inflamed, then they irritate the nerves chemically as they're traveling through this thoracic outlet. And so that's essentially what you might hear before, thoracic outlet syndrome. That might be a word you've heard.
Yeah.
That's the technical your technical diagnosis today is thoracic outlet on the left, but it's from left abuse, right avoidance. But we can symptomatically help you by cleaning the channel, right? Pushing the rib down, getting the bones in her neck in, which is the curve, stretching. This is smooth as anything.
Yeah, for a long time, because my traps were always activated and they were turned off, essentially. Even when I would work out, if I tried to do back exercises or any kind of upper body, I would immediately feel that area and it would just give me like a headache. So I had to kind of like train my body to turn off that muscle for a bit while I was working out.
I'll show you the curve. This is. So the molding we're going to do at the end, we're going to emulate my hand, and it's going to be placed up here in the upper neck, and we're going to have you head back. We'll do a little bit of right rotation to get a little more pressure on the right, okay?
Yeah.
And that should open up the left, and it should feel pretty good. Show you that at the end. Yeah, I mean, there's a lot of muscular tension in here. But again, they're being commanded to do it. And as your head comes back, as the curve restores, and as your head gets off the left side, this will all start to level out, and it won't need to be here. All right. All right. Maybe from holding trays, or I don't. Definitely, you and the rib cage. It's easy for this area to just become less mobile than our lower back and our lower neck. Yep. There you go. Stiff on this side. It's like this is the protected, guarded, old, injured, tight side. And then in terms of like lumps, it's not out of alignment as much as the left, but it's all lumpy, like right here, it's all tight, not functioning. There we go, like right here. That doesn't exist. This is smooth over here.
Mm-hmm.
And then I gotta.
It's crunchy.
Mm-hmm. Something's in here. Yeah, right there. Yeah. Probably the oldest injuries happened over here. This is back when you were 10, this is where the foundational injuries. Now you have the compensatory ones, but this is. Mm-hmm. Yeah, right there. Feel that?
Mm-hmm.
It's not feel right. Had a patient the other day. He's like, "What tool were you using on my back? Was it like some sort of roller ball?" I was like, "Well, was my roller that roller there?" He's like, "No, there's something else you were using." I'm like, "My elbow?" Oh!
Do you sell those?
That's what he was asking. He's like, "Where did I buy one of those roller balls you were using?" I'm like, "This thing?" I'm sorry, it's not for sale.
You should do one of those printing. What do you call those?
3D printers.
3D printers of your elbow to start selling it.
There you go.
Make a business.
Dr. Ed's elbow. That's right. Right there it is. All of this has to go down in order to bring the head back also. So in order to actually retract the head, this needs to move down. They move down at the same time. We call it coupled motion. So there'll be stretches I'll show you for the neck, but there's also stretches for the upper back that will need to be done. They both have to go together. Like pushing a drawer in, you can't just be pushing on one side of the drawer. Both sides have to go in together. There's going to be some marks on here. All of these crunchies are areas of tightness that have poor circulation, so they get so tight that they choke off their own blood flow. So it's essentially what a muscle spasm is, or a knot, if you want to call it that, but it's an area that becomes so tight that it now needs oxygen to relax itself. It's so tight that you need oxygen to contract a muscle, but you also need oxygen to relax a muscle. So now it's just like stuck and frozen. And then what happens is if you try to stretch it, you're not going to tear the knot, right? The knot's all protected. You're not going to tear the functional muscle over here. Where does it tear? Right, the connection between the functional knot and the healthy. That's how scars grow. That's how knots grow. Because you keep on injuring it right adjacent to the knot. And then the knot just keeps getting bigger and bigger. things back here that are uncomfortable. Maybe they're not painful, but they're uncomfortable, and they're at a point where that's what makes you desire to go to your side or your stomach. And so by cleaning your spine, by mirror image stretching and overcorrecting, we should make just laying on your back feel comfortable, and then you won't feel the desire to go away.
That would be great.
These are habits that we've had for a long time that are going to take time to break. Forward head posture, loss of cervical curve is the epidemic that we're dealing with right now. The technology 17 years ago with the iPhone accelerated this, where now we can spend most of our day just looking down. Yeah, right in there. Ooh. All right, easy, face down. No gua sha before, any cupping before? No. Not really.
Yeah, one.
Couple times.
A long time.
Okay. Same kind of category, it's just blood flow. So the areas that get tense, get tight, they get poor circulation. So the remedy is to bring oxygen in, and then when it binds to all the lactic acid, all the areas that have been poorly circulating, it makes a mark. These are the injuries. I'm making sort of a visual, and you can visually see what's inside. That this is why she wants to go to her stomach, to get away from these. People watching sometimes are like, "Oh my gosh!"
Yeah, it looks awful,
like
but
it's actually pretty soothing to me. I love being gua sha. It's like, just get it out of me, and you can feel it like, it's like good pains kind of idea. It's like, oh yeah, just get that knot out of there. Even how quickly the mark comes out of her left is different. The left being abused, it'll take more work to get it out of there. Because it's abused, it actually functions, actually has blood flow. Because it actually is moving, it doesn't have as much buildup because it's abused. Why did the mark come out bigger on one side? Well, because that's where it was more congested. I'll try to get this side. I can't make a mark come out. I only can draw out what's there. If there's no plaque on the teeth, I can't make a plaque appear. Oh, you're doing great, There we go. Okay, all right.
no, you're good. I can handle it.
I know it's in there. Just trying to get some blood in there a little bit. There you go. Here it comes. Yep, you're doing good. And here it is. Mm-hmm. You weren't supposed to look.
I was like washing my hands and I was like, oh my gosh.
I have the photos right here, all ready to go. Yes, I know.
Oh
That's the injury. That's
not even.
That's what's on the right side of your neck. That's the problem. Now, what will happen is, as we had proper care, that won't happen. That mark will just become pink. There will be no dark reddening. The dark reddening is the congestion. By visit 5, 6, 7, typically, if somebody lived here in Sarasota, you understand, we would work through that to the point where I'm combing you and nothing's happening. And that.
Oh my god, see, I look like I got dragged.
Right, I mean,
They tied me up to a truck and dragged me.
Yeah, it's bad. It's bad. There we go. Yeah. There it is. Come on, let it go. Yeah. Yeah, okay. All right, relax your chest, relax your back. Uh-huh. Ouch. Okay, you okay?
Yeah.
All right, arms down for me. Okay. Okay, all right. Let's lay it on your back for me.
Yeah, that area feels super tight. Thanks.
There you go. Okay. Get your leg.
That was real nice.
Clunk.
Yeah.
Wow, you're really still in the left foot. Yeah, there we go. I can't get that guy. Okay. Wow, this is the second toes. I got no movement there. I got no separation of the phalange with it. It's just
Oh, really?
it's glued together here.
I never knew that.
This one moves. I got movement here.
Yeah. That one
Stuck.
doesn't.
Here we go. I got you. Okay.
That's whatever moves.
Interesting. Go ahead and tilt your head to the left for me. Tilt left. Here we go. Go ahead and tilt left. Okay. Now. Might be self-popping our ears too. Okay.
Maybe then I could do that. Or do it.
Go ahead and tilt. 1 second. Go ahead and tilt to the right. Okay. And go ahead and 1 second. Go ahead and tilt to the right for me. Tilt right. Tilt right. Okay, done there. All right, have you lay over here for me. Try to get your head to go in, and then you do a little bit of right rotation, just a little bit, to get more pressure on that right side. Yeah.
I'm gonna go with pressure there.
Yeah, you want to work that right side. Maybe use your right hand. There you go. Just gently for about 5 seconds. You just push. Does that make sense?
Yeah.
And then you put your hand back down and relax. Kind of pressing it into the mold, and then see if your neck will stay there. This is the only way to really permanently change the position of your neck, is through stretching. No massage adjustments will change your neck alignment. To restore your curve in your neck, this is the first step. Along with getting rid of all the inflammation, the injuries in your neck, and adjusting you, that will bring your head back to a certain degree, but now we have to actually stretch the curve evenly in your neck. Okay. Okay, a little bit more, yeah. Good, perfect. I'm happy. How you feeling?
Good.
Let's see how that, just gently turn your head left and right, see how that feels compared to the beginning earlier. How's that
Yeah,
feel?
it does feel a lot better. I
Okay.
don't feel so much the pinch.
All right.
Question.
Yes, ma'am, please.
I want to know if there's one thing that I'm doing recently. When I feel like, because my shoulders, like I said, they're always running forward.
Yes.
I don't know if it's gonna crack now, but I usually do something like this.
Yeah.
And, oh, did you hear that?
Yes.
I
Clap.
pop back, and sometimes it pops here.
AC joint.
Sometimes it pops here.
Yes.
So
Doesn't bother me.
doesn't bother you? Okay. Maybe if I'm cracking it in the right
No.
direction, maybe it's okay.
It's because the joint's jammed, because our shoulders are on forward, so the clavicle attaches to the sternum, attaches to the acromion. AC joint, your sternoclavicular joint. You know, generally, what happens is people that are rounded forward so much, you'll actually start seeing the clavicle not only jam, but it'll start to rise up on the sternum. People will see bumps on people's sternums here where the clavicle is starting to actually rise up, and so you want to, open up the chest, arching the body back. And maybe I mentioned earlier, the other thing is the roller. You start with a foam roller, and you get on your back. I'll show you in a minute. You'll have it right here, and you work your way down to the bra strap. You start, up here. At the end of my videos, we usually see, rolling the spine. You want to work on at the same time when you're doing that. You can have your arms to the side.